Hey guys, let's talk about one of the most difficult conversations that we have to have with patients as urologists when we tell them that your bladder doesn't function and there's little we can do to get it to regain its function. And let's make sure that's not affecting you. Stay tuned. Hey guys, Dr. Segal here. So the question is, my urologist has given up on my bladder. How can that be? So we're going to go through some of the causes for this, whether this is a real phenomenon or not. Some people are not sure about that or dubious about that. And at the end, I'm going to talk to you about the one test that can answer this question as to whether your bladder functions or doesn't function. So make sure you stay tuned to the end for that pearl of wisdom. So here's your bladder, okay? These are the tubes that go into the bladder. These are called ureters. These feed urine from the kidney down into the bladder, okay? And if you notice this bladder, this is the urine here, and it's about half full. This is the time when you want to pee, okay? You don't want the bladder to be overfull, and we'll talk about why for a variety of reasons and how that is related to a non-functioning bladder. Your bladder squeezes the best when it's at kind of half volume, maybe 3/4 volume, but certainly not when it's over distended or it's got the maximum capacity that it can hold. If you think about it, when you wake up in the morning and you slept great and you want to try to pee, it's pretty darn hard, isn't it? And it's hard because that's the time of the day when your bladder is the fullest, when it's been accumulating urine all through the night. So the first thing that I would tell you to make sure to keep your bladder healthy is to urinate or pee at the first kind of sign that you have to go. You want to keep that bladder empty on a regular basis. What happens if you don't is, let's say this urine kind of fills up in the rest of the bladder. Now that's no big deal on a intermittent basis, but if that happens over time, this bladder, it's got a muscle in it, all right? This is the muscle layer of the bladder. And that muscle gets weaker and weaker and weaker. So if the urine is pushing on this muscle, initially the muscle might get stronger, okay, to try to push urine past the bladder outlet or past the area of where you pee out of. But then over time, it'll start to lose its function. And I'm just going to tell you some classic examples, some classic stories of when and how this happened. Some people have a stricture, a narrow area of the urethra. I've used this analogy a bunch of times in these videos. You guys know I love analogies. We're like plumbers as urologists. So if you got a narrow pipe down here, urine can't get out, that urine backs up to the bladder, and over time, it can slowly stretch and stretch and stretch out the bladder. So that's called a stricture, a urethral stricture. Can cause chronic, incomplete bladder emptying. Some people have jobs where they have to hold their urine a lot. And the classic one that I hear is a truck driver. So if I see a patient that's a truck driver, the first thing I say to them, you're making regular stops to use the bathroom, right? They think I'm nuts, but I've seen guys and girls that are truck drivers and they have to chronically hold their urine because of the nature of their job. And I've seen them where they have an extremely distended, extremely full bladder. They don't even know it because it's been like that for quite some time. And we discover that the bladder just doesn't have its squeezing capabilities like it used to. And that's not just truck driver. That's just one of the more common jobs where I see that. Any job where you're required to hold your urine for extended amount of times because of availability of bathrooms. One of the other reasons why is bladder outlet obstruction. So what we call an enlarged prostate. So your prostate would sit here, okay? Again, the plumber analogy, urine can't get out past that prostate. And over time, if we're not cognizant of it, that urine keeps backing up into the bladder, stretches out the bladder doesn't function. So an enlarged prostate can be responsible for a non-functioning bladder. Pelvic organ prolapse. So this is certainly an example in women. Women don't have prostates, obviously, but they do have the ability for the uterus, the rectum, any structures in the pelvis to prolapse or fall in front of the bladder. And when they fall in front of the bladder, they cause an obstruction or ball valve phenomenon, and that impedes the flow of urine. I've seen patients with extremely significant pelvic organ prolapse that carry a ton of urine in their bladder, and there's not much we can do to fix it because this has been a chronic problem for them. So that is a possibility as well, pelvic organ prolapse in females. There are neurogenic or neurologic reasons for it. Multiple sclerosis can affect the nerve input to the bladder and cause the bladder to not squeeze regularly and properly, and then the bladder fills up over time. Really bad diabetes. So I've seen people that have type 1 diabetes. Their bladder has been full for years and years and years. Their diabetes has been under poor control. And because of it, the bladder is so distended or big that it's gotten to the point that it cannot squeeze any longer. It's called diabetic cystopathy. It has to do with the damage to the nerves that go to the bladder. And typically this is in somebody that's a type 1 diabetic with poorly controlled sugars for a significant part of their life. Okay, so that's one other kind of clinical example. Then the next question, when we tell them that, a lot of people, don't necessarily believe it, understandable, but they say, well, if it is the case, what can you do? And it's one of the most difficult problems for us to fix as urologists. We focus our attention on emptying the urine out of the bladder by kind of mechanical methods. Sometimes we'll teach patients how to catheterize themselves a few times a day, which a lot of people look at me like I'm crazy when I tell them that they got to do that. But over time, most people get used to that. Some patients that aren't able to do it, if they have problems with their hands, dexterity, Parkinsonism, they can't catheterize themselves. And so we're relegated to letting them have a chronic catheter in their bladder that drains to the outside world. And we change that every 4 to 6 weeks. That's not a preferable option for us. And we have another video that talks about that. But that is something that we have to do sometimes. Some people don't like the idea of having a chronic catheter from their urethra or the penis. And they don't want to catheterize, or they can't catheterize. And so we'll actually put a tube in from above, from the abdomen into the bladder. And this is called a suprapubic tube. Okay, it goes from right above your pubic bone into the bladder itself, and it's changed every 4 to 6 weeks. For a lot of people, that's much more comfortable than a catheter from below. A lot of people don't like any of these as options, and they'll ask, is there anything that you can do? Anything that you can do to get my bladder functioning again? We have tried, and I have tried InterStim, which there's another video on that, which is sacral neuromodulation. So there's, I know that's a big word. So there's a lot of nerves that go to the bladder, right? And if these nerves are not kind of telling the bladder to squeeze, sometimes we can put a thin wire to these nerves, okay? And stimulate the nerves to tell the bladder to contract more readily. Now, frankly, this doesn't work the majority of times, but oftentimes it's worth a shot, especially in somebody that's young and frustrated with neurogenic urinating issues, or not able to pee because of a nerve problem going to the bladder. The first thing that guys with an enlarged prostate and this type of bladder or a non-functioning bladder ask are, my buddy got a TURP. You did a surgery and opened him up and he's peeing great now. Why can't you do that on me and get my bladder functioning again? TURP is opening up the prostate, okay, to generate a better stream. And if your bladder is to the point that it cannot squeeze, we can open up your prostate to kingdom come and urine is not going to get out because it's got no squeezing capability, all right? So in general, opening up the prostate won't help in that situation. Now, if your bladder does have some function, it's worth trying it. And I usually tell my patients that have minimal function of their bladder that it's worth a shot to try to get you to pee some. And that brings me to my next point, and this is my pearl of wisdom. People, when I tell them that their bladder oftentimes doesn't function, or I don't think it's going to function, the first thing they want to know is, what is the data? How do you know my bladder does not function? And this is the one test, and this is kind of my pearl of wisdom for the one test that can figure out the answer to that question. It's called a urodynamics. Okay, so we put a catheter in the bladder, we start filling up the bladder, and then we ask the patient to try and pee. And what we can do is, when they try and pee, we can transduce or figure out the bladder pressure. And if their bladder pressure is above a certain number, then we say, you know what, your bladder still does have some function to it. It's worth considering an option to get you to pee better, like a TURP procedure. But if we fill their bladder up with fluid, we ask them to try to pee, their bladder tries to squeeze, and we see little to no contractile force of the bladder, then we know that the bladder is not functional. And this urodynamic test is done in most urology offices. I would say it takes 10 minutes, and it can reliably answer this question: does your bladder function? Does it not function? Okay. So hopefully that gives you kind of 101 on how we think about non-functioning bladders. It is a real phenomenon. We do have limited capabilities of fixing such a problem. I hope that's helpful to you all. Thank you so much for listening. We certainly appreciate it. Please subscribe to our channel. Please look at other videos in this playlist so that you can be as expert as us in all aspects of urologic care. Thank you so much again.